Hi everyone. I know it's been a few days since we last had a session. However, there's a reason for that. Due to the severity of the lupus that I have to have monthly infusions to keep, or to help keep rather, lupus in check. There's no way to really keep it in check. Autoimmune conditions have a mind of their own. The flares come on for many different reasons. One of the main things that can trigger autoimmune flares are stress, direct sunlight, but it can also be something as simple as an allergy attack or a cold, food that you may eat. For each person, it's different. In order to combat really severe cases like mine, there are a few research physicians out there that go to the mat to make sure that patients like me, and maybe even some patients like you, have an alternative treatment, something safer, something more life-saving than prednisone. And we'll save the prednisone conversation for another day. And for you, those of you who don't know what prednisone is, most of you should. It's a steroid that's used to help supposedly keep your symptoms in check, but it actually just kind of masks your symptoms, makes you feel better when you're not necessarily better. It tricks your body and tricks your system into temporarily thinking it's receiving relief when your disease is actually still very active and actually could be still very dangerous for you if it's in a very active state. Okay, back to Benlysta, the treatment that I had on yesterday for lupus SLE, CNS lupus, and for vasculitis. It is an autoimmune treatment that's given via IV. It's extremely similar to chemotherapy as far as the way that it's administered. You're hooked up to an IV for a couple of hours, and first they start with a saline, and then they move on to treating you with the actual medication. So the treatment is administered exactly the same as chemotherapy. I've had both chemotherapy and IV Benlysta treatment over the past 4 years, and the side effects that come on after the treatments are almost identical as well. Some of the side effects that you can expect to experience with Benlysta or treatments like it would be nausea, fatigue, body aches, headaches, diarrhea, cramping, restlessness, weight loss, loss of appetite, etc. If you want to know more about lupus treatments and or other chronic illness and autoimmune treatments, I would suggest that you just take the time to go onto the net and research a little bit. You can go on to Benlysta, www.benlysta.com, and it'll give you all the information that you need about that particular drug. So for those of you out there who are not getting enough information from your physician about prescribed treatments and or treatments that are maybe not even officially approved yet, because a lot of us that are chronically ill and or have autoimmune conditions that are being treated, some of us have the privilege of being connected with physicians or programs that offer trial method treatments, which is what Benlysta started out as. It started out as a trial treatment, and I started out with that some years back, and it works great for me. However, it is a medically proven fact that Benlysta does not work well for most African American patients and or Hispanic patients. But I would suggest to not throw it out the window if you are of an African American or Hispanic or Asian background. Give it a chance, give it a try if your doctor is suggesting it for you, because it very well may work for you. It says right on the Benlysta website that it does not have a high rating of success for African Americans and certain other ethnic backgrounds. However, it has worked great for me over the years. So, any treatment that your physician is suggesting for you, my big tip of the day would be research it for yourself. Read as much about it as possible. How do you do that? It's as easy as 1, 2, 3, a click, and a few words typed in, a few letters typed in, actually. Just about anything that you want to know about any medications that is prescribed for you. You don't have to wait around for your doctor to tell you about it. In fact, most physicians would tell you to just go on the net and research it for yourself. Don't just trust the pamphlet or go on the word of something you've heard from someone else. Research it and figure out how it's worked for other people, which is usually available online, and also exactly what the trials were like when the medication was first introduced. That's also available online, and you can find that out simply just by typing in the name of the drug and putting trial results behind it in your web browser. So, I'm not feeling so awesome today. It took me a couple of days, since yesterday morning when I got the infusion until this evening to gain up enough strength to do this YouTube cast. I'm in a lot of pain. It's getting a little bit better since I took some pain medication and have been resting, but I'm extremely fatigued. My stomach's upset. My appetite's very low, and I'm extremely, extremely tired. And that may be a little different for each person. It may last shorter or longer for different people, and some people can get Benlysta treatment and not have very many side effects at all. And the same is true for chemotherapy. So as I said, don't knock it before you try it. Give your physicians an opportunity to treat you before you dismiss everything. I am all for completely neuropathic treatments, but sometimes you need a little bit more. Sometimes your body does need some help. So that's it for today. I hope that you all will think about this YouTube cast whenever you're worried or not sure about getting a particular treatment, and you will take the tips that I'm giving you and sharing with you today about treatments and seeking out the best possible avenues for yourself. All in all, and overall, whether you're receiving the treatments or not, one of the most important things you can do for chronic illness and autoimmune disease is to rest. Rest and keep yourself spiritually motivated. When you have that downtime where all you can do is lie there and be still, take that time to communicate with the Creator. Take that time to read some devotionals, maybe some positive books, or just to read a little bit more about your particular condition and treatments that are available for it. But whatever you decide to do, make sure that you seek God and His instruction before you say yes or no. He always knows best for us, even when we don't know what's best for ourselves. God bless you. Have a really great evening.